I'm Aundrea Cline-Thomas with ISPOR TV. Here to discuss expanding the definition of value for the HEOR community is Lotte Steuten. Thank you for being here. What does the EU Joint Clinical Assessment mean for the ISPOR value flower?
That's a great question. So maybe I should first explain a little bit what the ISPOR value flower is, because after all, we're health economists and we're no gardeners. So the ISPOR value flower was originally developed by OHG and then further developed and widely published by the ISPOR community. And it really tries to capture the broader value of healthcare interventions beyond the clinical effectiveness as well as the cost on the healthcare system. It also incorporates, for example, productivity impacts on family, carers when someone of their loved ones is ill, but also things as disease severity. So think of it as a flower with petals, and all the petals represent one element of broader value. So you ask, what is the impact of the EU JCA on this value flower and its usage? Now, the EU JCA tries to sort of bring together the European countries, the EU countries, I should say, to really harmonize the way they do clinical assessments. So they all work together on bringing these clinical assessments forward to the national HTA organizations, and they then take this forward into their decisions about what products to reimburse and for how much. Now, this JCA focuses only on clinical effectiveness, so that is only one element of the value flower. So there could be potentially an impact on whether this flower is used or not. So I kind of like to think about it in this way. Will this potentially kill or grow the value flower? And if I want to be optimistic first, then we see that if the clinical assessment is done already, basically delivered as a sort of ready-made bouquet to the HTA decision-making bodies or bodies that give recommendations, then that might potentially give them more time to sort of dig deeper into the other elements of value of this flower. Conversely, there's also a bit of a risk that because everyone is super busy now at implementing this very important new step in EU HTA, is that the focus will mostly be on this clinical effectiveness, and that maybe the countries do not have the bandwidth to really explore some of these broader value elements. So I think if you ask me what will happen, that's very hard to answer at this point. I think in the short term, it may slow down the focus or may slow down the growth of this usage of the broader value elements. But in the longer term, I think there's potential to have much more time and resources available to really get more serious about considering these very important broader elements.
Let's talk about that longer term.
Yeah.
Explain that, go a little bit deeper with that of why.
Yeah, so in the longer term, if the JCA indeed would deliver efficiencies in the way that the clinical assessments are done, so like I said, basically delivering these to the HTA bodies, then they wouldn't have to spend so much time sort of exploring that each on one by one on their own. And that would potentially free up some of those resources in those HTA bodies to really do further work, and also all the researchers around them to do some further work and understand how can we measure these elements of broader value? How important are these? Can we incorporate these into our cost effectiveness analysis? Because that will always still be done on a national level. So in the longer term, once we figured out how to sort of do the JCA in a good way and hopefully in a more efficient way, which is a question mark at this time, obviously. But then I think the JCA has the potential to be, let's say, a fantastic gardener for these value flowers.
But you said in the short term, it could slow things down.
Yes.
So what are the growing pains that people have to go through to get to those long-term benefits?
Yeah, so I think the growing pains now really are that this is the first time such an EU-wide clinical assessment is done. So everyone involved is very much sort of a bit nervous at this point in time because we haven't done this before, and it's very, very important for patients and for society, for everyone, that we get this right. So everyone is now super focused on that element, the clinical effectiveness. And therefore, I think in the short term, there might be not so much bandwidth to really sort of think and do further work around these broader value elements. I think the focus very much is on getting the clinical effectiveness at the EU level right and figuring out how to do that. And then in the longer term, I hope there will be more time and resources to think about a broader value.
We continue the conversation with Chris Blanchette. Much of your work has involved measuring the value of GLP-1 inhibitors for obesity. How does this disease relate to whole health and the HEOR evidence needed to support innovation?
Yeah, thanks. That's a great question. So And obesity is a disease that affects many patients, over 100 million patients just in the U.S., not even globally. But it's a disease that does affect their whole health. The downstream effects of obesity affect the cardiovascular system, the liver, nephrology system, all cardiac systems. So it's all types of systems that are affected. And so when you start to look at the downstream effects of obesity, you start to realize that it is the whole patient that's affected by the disease. So that's why treating obesity is so important to helping the patient himself. And that's why as we advance all of our new technology and we see the obesity research continue to build and develop, it's really at the crux of whole health in treating those patients.
What's the next phase of these drugs, would you say, in terms of what they address?
Yeah, so I think the next steps are thinking about those comorbidities. So right now, the first step was really to look at weight loss and continue to look at higher levels of weight loss. But the next level is really to start focusing on all the downstream effects of weight gain and obesity, which are how those diseases affect progression, right? And how those debilitating factors affect patients. So that's going to be the key to the next generation.
Are there specific ailments that research is going to be centered around? Is it high blood pressure? Is it diabetes? Things of that nature?
Yeah, I think what we've seen is a lot around cardiovascular disease, liver disease, in a number of different areas. We're still learning a lot around what obesity affects in the system and better understanding of how to target those specific diseases as they progress. So, but a lot of new information that's coming out rapidly around it.
What excites you moving into the future?
Yeah, well, I think what excites me is just knowing that we're helping patients. We're helping people that need help, and that we're bringing solutions to them that can help them live better with the disease and reduce that burden on them and giving them a lot more fulfilling lives back. And I think as an industry, we're doing that. So it's not just our medicine, but the industry is developing, and it's the next thing to focus on to help patients.
We thank all of our experts for their valuable insight. I'm Aundrea Cline-Thomas with ISPOR TV.